Good morning, guys. Tony Maritato here. So in this video, I want to talk about icing your knee either before an exercise, during an exercise, or after an exercise session. I'm working on an article right now. It should be public by the time this video comes out. But basically, you can use ice in a lot of different ways. You can ice the knee before you exercise. So a lot of patients will experience pain and stiffness when they've been sitting or sedentary for a while. They're thinking about doing their home exercise program and they're thinking, I don't even want to move my knee, let alone exercise my knee. So a great way to use ice to allow you to exercise more effectively is to just go ahead and ice before you actually do your exercises. The icing is going to numb the knee. The knee is already stiff, so yes, icing will make it stiff, but it's already stiff. So I find that some patients feel better if they ice first and then begin their exercise. The only advice I would give you if you're using this technique is the first exercise you do after icing should not be an exercise that requires you to go to full range of motion. You want to do a gentle motion within the available range that doesn't cause tissue stretching. After you've done that exercise, then you can go into a more aggressive end range of motion exercise. But icing before exercise is something that you can do. Next, we're going to go to icing during exercise. So a lot of people, if they're doing a recumbent bike, stationary bike, if they're doing some sort of knee repetitive flexion extension, if you strap an ice pack around the knee, it will help numb the area and it might help you tolerate the exercise a little bit better. It might reduce some of the muscle guarding, some of the soreness that just makes it less pleasant. If you're gonna do something like that, having a strap to hold the ice pack on the knee is an important component because obviously you're moving, you're flexing, you're extending. We need something that's relatively elastic, something that allows the ice pack to kind of move with the motion. And then finally, there's icing after exercise, which is the most common way people will do ice at home or in the clinic. If you're icing after exercise, I do recommend you place the knee in a position that works whatever range of motion you're having the hardest time with. So if you're having a hard time with knee extension, then what you would do is you would place the knee in extension. Preferably you'd have it unsupported. So I'm in a chair, I'm placing a similar chair in front of me. There's no support under the knee. Now this is a Chattanooga cervical pack. I like the larger packs, but they're all in use right now. So I'm gonna use what I've got, but I would place the cervical pack over and kind of tuck it under. This is a knee strap. The company is Mava, M-A-V-A. I can put links to these two products down in the description. And effectively what I'm gonna do is I'm going to wrap the ice pack on the knee. Now, if it's too cold for you to tolerate the straight Chattanooga pack on the knee, you can put it in a pillowcase. That's what we would usually do in the clinic. Since I'm wearing a pair of pants and I'm not that sensitive to cold, I'm just gonna put it straight on like this. But the idea is in this position, I'm working on knee extension while I'm icing the knee. This will help numb it as well as improve the range of motion. Thanks for watching, guys.